Press.
Dandruff. Introduction. Dandruff is a common skin condition. Almost all people have it at some time in their lives. Dandruff causes flaking skin and an itchy scalp. Dandruff isn't contagious and it is rarely serious, but it can be embarrassing. A gentle cleansing shampoo can be used to treat mild cases of dandruff. More stubborn cases of dandruff often respond to medicated shampoos. This program explains dandruff. It discusses the symptoms and causes of the condition, as well as treatment options. Dandruff. Dandruff can affect the scalp or any area on the body that grows hair. It can also affect any area with small hair follicles. A type of dandruff called cradle cap can affect babies. It causes a scaling, crusty scalp. It is most common in newborns, but it can happen any time during infancy. Although it can be scary for parents, cradle cap isn't dangerous. It usually clears up on its own by the time a baby is a year old. Does dandruff only affect babies? Select yes or no. Correct. Dandruff can affect people of any age. Cradle cap is the name for dandruff that affects babies. Symptoms. Dandruff symptoms include an itchy, scaly scalp, white, oily-looking flakes of dead skin on your hair, neck, and shoulders. Dandruff typically looks like dry, flaky skin on a scalp. There may also be areas of pink or red inflamed skin. Many people with dandruff may have no scalp symptoms. Their only symptom may be white flakes that fall to their shoulders. More severe cases of dandruff may cause intense itching, burning, and scratching. Symptoms of dandruff may be worse during the fall and winter and improve during the summer. Some people with dandruff may not have any scalp symptoms. Select true or false. Select correct. Many people with dandruff may have no scalp symptoms. Their only symptom may be having white flakes that fall to their shoulders. Causes. Dandruff can be caused by several conditions. Dry skin is the most common cause of itchy, flaking dandruff. This can happen during winter when the air is cold and rooms are overheated. Dandruff flakes from dry skin are generally smaller and less oily than those from other causes of dandruff. If your dandruff is caused by dry skin, it is likely that you have symptoms on other parts of your body, such as your legs and arms. Another frequent cause of dandruff is irritated, oily skin. This condition is known as seborrheic dermatitis. It causes red, greasy skin covered with flaky white or yellow scales. Seborrheic dermatitis may affect not only your scalp, but also other areas rich in oil glands, such as your eyebrows, ears, nose, armpits, breastbone, groin area. Dandruff may be caused by not shampooing often enough. If you don't regularly wash your hair, oils and skin cells from your scalp can build up. This results in dandruff. Psoriasis is a skin disorder that causes a buildup of dead skin cells. They form thick, silvery scales. Psoriasis commonly happens on your knees, elbows, and trunk, but it can also affect your scalp. If you have eczema anywhere on your body, it could also be on your scalp, possibly leading to the development of dandruff. Eczema causes red, swollen, and itchy skin. Sensitivity to hair care products may lead to dandruff symptoms. This condition is called contact dermatitis. Sensitivities to certain ingredients in hair care products or hair dyes can cause a red, itchy, scaling scalp. Shampooing too often or using too many styling products also may irritate your scalp, causing dandruff. Malassezia is a yeast-like fungus. It lives on the scalps of most healthy adults without causing problems, but sometimes it grows out of control, feeding on the oils secreted by your hair follicles. This can irritate the skin on your scalp and cause more skin cells to grow. The extra skin cells die and fall off, clumping with oil from your hair and scalp. This makes them look white and flaky in your hair or on your clothes. The cause of Malassezia overgrowth is not known, but it may be caused by having too much oil on your scalp, hormone changes, illness, stress. Other causes of Malassezia may include a suppressed immune system, neurological disorders such as Parkinson's disease, not shampooing often enough, sensitivity to the Malassezia fungus. Almost anyone can have dandruff, but certain factors can make you more likely to have it. More men than women have dandruff. Some researchers think male hormones may play a role in dandruff. Men also have larger oil-producing glands on their scalps, which can contribute to dandruff. Dandruff usually begins in young adulthood and continues through middle age, but for some people, it can be a lifelong problem. If your diet lacks foods high in zinc, B vitamins, or certain types of fats, you may be more likely to have dandruff. For reasons that aren't clear, adults with neurological diseases, such as Parkinson's disease, are more likely to develop seborrheic dermatitis and dandruff. So are people recovering from stressful conditions, particularly heart attack and stroke, and those with weakened immune systems. Dry skin is the most common cause of itchy, flaking dandruff. Select true or false. Correct. Dandruff can be caused by several conditions. Dry skin is the most common cause of itchy, flaking dandruff. This can happen during winter when the air is cold and rooms are overheated. Diagnosis. Most cases of dandruff don't require medical care. But if you're still scratching your head after several weeks of home treatment with over-the-counter dandruff shampoos, or if your scalp becomes red or swollen, see your healthcare provider. You may have seborrheic dermatitis or another condition that resembles dandruff. Often, your healthcare provider can diagnose the problem simply by looking at your hair and scalp. If you've started using any new hair care products, bring the bottles with you to your appointment or be prepared to tell your healthcare provider about them. He or she can tell if the products may be causing your dandruff. Treatment. Dandruff can almost always be controlled, but dandruff treatment may take a little patience and persistence. In general, daily cleansing with a gentle shampoo to reduce oiliness and skin cell buildup can often help mild dandruff. When regular shampoos fail, over-the-counter dandruff shampoos may succeed. But dandruff shampoos aren't all alike, and you may need to experiment until you find one that works for you. If you develop itching, stinging, redness, or burning from a dandruff shampoo, stop using it. If you develop an allergic reaction, such as a rash, hives, or difficulty breathing, seek medical care right away. Dandruff shampoos contain different medication. Talk to your healthcare provider about what type of shampoo is right for you. Try a dandruff shampoo daily or every other day until your dandruff is controlled. Then, cut back to 2 or 3 times a week as needed. If one type of shampoo works for a time and then seems to lose its effectiveness, try alternating between 2 types of dandruff shampoos. When you wash your hair, lather once, rinse, then lather a second time, and rub your scalp as you shampoo. Leave the shampoo on for at least 5 minutes. This gives the ingredients time to work. Rinse well. This will help get rid of all the cells you have loosened up during shampooing. If you've shampooed for several weeks and you still have dandruff, talk to your healthcare provider. You may need a prescription-strength shampoo or lotion. Does dandruff always require treatment with a prescription-strength shampoo? Select yes or no. Correct. In some cases, you may need a prescription-strength shampoo or treatment with a steroid lotion. These are often tried after regular shampoo and over-the-counter dandruff shampoos. Lifestyle and home remedies. You can take steps at home to reduce your risk of developing dandruff. Learn to manage stress. Stress affects your overall health. It can trigger dandruff or worsen existing symptoms. Shampoo often. If you tend to have an oily scalp, daily shampooing may help prevent dandruff. Cut back on styling products. Hair sprays, styling gels, mousses, and hair waxes can all build up on your hair and scalp, making them oilier. Eat a healthy diet. A diet that provides enough zinc, B vitamins, and certain types of fats may help prevent dandruff. An alternative therapy that may reduce dandruff is daily shampooing with tea tree oil. Tea tree oil has been used for centuries as an antiseptic, antibiotic, and antifungal agent. It's now included in a number of shampoos found in natural food stores. The oil may cause allergic reactions in some people, though. Summary. Dandruff is a common skin condition. Almost all people have it at some time in their lives. Dandruff isn't contagious and it is rarely serious, but it can be embarrassing. Dandruff can affect the scalp or any area on the body that grows hair. It can also affect any area with small hair follicles. Dandruff symptoms include an itchy, scaling scalp, white, oily-looking flakes of dead skin on your hair, neck, and shoulders. Dandruff typically looks like dry, flaky skin on the scalp. There may also be areas of pink or red inflamed skin. Treatment may include regular shampooing, over-the-counter medicated dandruff shampoo, or prescription-strength shampoos or lotions. Dandruff can almost always be controlled, but dandruff treatment may take a little patience and persistence. Talk with your healthcare provider about what options are best for you.